And welcome to another episode of COVIDpreneurs. And if you're like many, your 2020 plans have been severely altered in the wake of the pandemic. Perhaps you're waiting out the storm, or maybe you've made alternative plans, but maybe you've discovered a silver lining in the disruption and are using it to help others. That's exactly what our guest today has done, and I cannot wait to introduce her. I'm Dr. Dawn Graham, author of Switchers, How Smart Professionals Change Careers and See Success, and I'm the host of Dr. Dawn on Careers on SiriusXM, channel 132. And today I'm your guest host for COVIDpreneurs on Radivision, and I'm thrilled to be here with Dr. Jennifer Meller, not only because she is changing the safety and satisfaction of healthcare patients, but because I've had the opportunity to see her do so many amazing things from when I first met her a few years ago at the Wharton School's MBA program. Dr. Jennifer Meller is the founder and CEO of Navimize, which is a healthcare IT company that offers many benefits to both patients and physicians. So, Dr. Meller, in a few sentences, can you share with the audience a little bit more about Navimize?
Sure, Dawn. First, I'd like to thank Radivision for the opportunity to be online today, and thank you for that wonderful introduction. Navimize, as you mentioned, is a digital health company, and our platform actually features a virtual waiting room to help health systems and healthcare providers empty the physical waiting room and keep patients and providers safe for COVID-19 and beyond.
So there's a great video that we want to show you now that will give you a little bit more about the insight to what Navimize is all about.
Meet Dr. Watson. He runs a busy practice, so his waiting room can get pretty full. Every day is the same. Urgent calls, last-minute add-ons, short visits turn into long visits. Emergencies throw off the whole schedule again and again. The waiting room fills. Dr. Watson knows happy patients are critical to his practice, yet he can't fix this problem. Even if he could predict the delay, his staff doesn't have the time to contact his patients before they show up. Now meet Dr. Smith. She has 5-star reviews and even more patients than Dr. Watson, but her waiting room is almost empty. What's going on? Dr. Smith's office is using Navimize. Navimize seamlessly integrates with practice management systems to scan patient flow, scheduling information, appointment progress, and more. Its advanced proprietary algorithms work dynamically in real time, updating throughout the day to calculate and predict wait times. Then, Navimize sends an automated message to each patient so they know about any delays.
No matter how overbooked Dr. Smith is or what emergencies come up, Navimize's powerful technology is working to keep her office running smoothly.
Dr. Smith trusts Navimize because it was created by doctors just like her. Thanks to Navimize, her office is organized, reputable, and sure to keep growing.
So, Dr. Meller, I have to start out with, just getting to know you a little bit, because this is such an amazing product that's going to help so many. So let's kind of take a step back. And how did you get interested in a career path in medicine to start with?
Sure. So I decided that I wanted to be a doctor at a pretty early age. When I was 8 years old, I was asked to write a composition in school about what I wanted to do when I grew up. And I wrote all about wanting to be a doctor and help people and do something meaningful with my life. As you might imagine, that garnered a lot of positive feedback from teachers and parents, etc. But as I got older, I was always interested in science, and I really liked the intellectual stimulation that medicine offered, the ability to do something meaningful with my life, help other people. And it also provided a lot of opportunity, not just for clinical care, but also for research and academics. I think the other thing is that I grew up in a home where my mom was a product of the 60s and 70s feminist movement, and she had only daughters, no sons, and really promoted us to have meaningful careers and go out there and really take charge. And she actually was a teacher who then became an assistant principal who always regretted not going to law school. That was her dream. And my dad was a scientist who always had a little kernel of regret of not going to med school. So I became a doctor, my sister became a lawyer, and I'll let the psychologists out there have a field day with that one.
So everybody kind of got their wish in a roundabout way.
Yeah. Oh, yeah.
Well, medical school is a big accomplishment in and of itself, but then you went on to get your MBA from the Wharton School, which is one of the top programs in the world. Did you go there knowing that you were going to start your own business?
Yeah, not at all, actually. I had completed NYU med school, then went on to work, did my residency at NYU, then went on to work at Columbia University in a faculty practice, which actually was a pretty independent practice, although it was run under the aegis of Columbia. And ultimately moved my practice into Manhattan, where I had my own private primary care practice. I did that for about 15 years. And after that time, a few things started to happen. One is that I sort of felt like what I was doing day in and day out was becoming a little bit routine, and I was in search of a new challenge. And the other thing that happened was that I looked at what was happening in the industry around me. There were a lot of changes. Reimbursement was going down, regulation was going up. I saw a lot of my colleagues actually giving up their independence and going to work for big groups and hospitals. And I wanted to have more options. I saw health tech exploding and thought, business school would be a way to provide a world of new opportunities and new directions for my career.
So a lot of people watching Dr. Miller are probably in that stage of, is entrepreneurship for me? Is this something I should try? So when did you know that that was going to be your next step?
So again, when I started business school, I really wasn't thinking about starting my own business, but I guess the seeds were planted even, I think at the interview. There was someone on the admissions committee who asked me about why I gravitated towards independent roles in my career. And I never really thought about it. And I sort of had to take a step back and think, gee, the residency program I chose was very independent. The residents worked very independently without a ton of input from the physicians, from the attending physicians. The job I took at Columbia, although it was a faculty practice at the time, back in the day, we ran our own practices and ultimately went out and established my own practice. So I thought, gee, I always have gravitated towards these positions where I'm very independent. And there I was in business school and was learning about lean management principles one day in school and started thinking about waste, about waiting room being a wasteful place, wasting time within that framework. Now, I'd always run behind schedule in my practice. I tried not to. I rearranged my schedule a million times, but just always had those emergencies and things come up where I ran behind. And I had noticed in the few years prior that we moved into this world of online reviews, and that patients would say online, oh, she's great, but the wait is terrible. And I also noticed that I was starting to see competition from urgent care centers and minute clinics who could get patients in and out much more quickly. And so I knew this was a problem. I identified it as a problem. And there I was in school, and one day walked outside, ordered an Uber, looked at my phone and said, if I can see what's happening with this car, even though it's not physically in front of me, my patients should be able to peer into my waiting room and just know what's happening before they head to my office. And that's really how Navimize was born. That's how the idea was born, and I kind of ran with it from there.
I love that. I love it. That makes complete sense. And it makes sense how that evolved into the idea that it is today. And for those of you who are watching, if you have questions about Navimize, about Dr. Jennifer Miller's journey or entrepreneurship, we invite you to put those in the chat because we will be getting to those questions later. So Dr. Miller, this was your first official startup. And what we hear from the statistics is that a lot of times the first, second, and even third one doesn't work out very well, but Navimize is really taking off. So what do you think, made this take off in the way it did?
So I think a few things. I think the first thing is that when you are an entrepreneur and you start a business, you really have to have a passion for what you're doing. And this is a problem that I'm trying to solve because I experienced it firsthand. So I'm really passionate about solving this problem, about doing something that'll improve the lives of patients. So I think that's helped me a lot in pushing this forward. I think the other thing is that I have built businesses before, not startups, but I've had to build up my practice really from scratch twice in my career. So I have that experience under my belt. And some of the other things, I think, I'm not 22, coming right out of college. I did this mid-career. And so being a little older when I started this journey, I think has helped me because I understand what my skill sets are and where I need guidance. And I kind of have the humility at this stage of my life to go and ask for help when I need it, which has been, I think, a huge help. And the other thing not to overlook, which is super important, is that I've had a fantastic co-founder. So Kavita Mongol, who's my classmate at Wharton, tech genius, has been my kind of partner in crime from the beginning. We have very complementary skill sets. We have complementary personalities. We don't always agree all the time. And so being able to have this exchange of ideas with somebody who I respect and who brings a different viewpoint to the table, I think has been really key to the company's success.
Yeah, that makes total sense. It's really important that the people around you are a conduit to those new ideas and that input and feedback. So was there a particular moment, Dr. Miller, that you said, wow, this is viable, this is going to happen, this is going to make it?
Yeah, I think it was an evolution. So we just got a lot of positive feedback along the way, along this journey. So again, this started as an idea in business school. And I teamed up with Kavita, whose background was in tech, who said, oh yeah, we can make this happen, we can do this. And so we entered an innovation tournament and wound up placing second out of something like 450 ideas submitted. And then we applied to the Wharton Venture Initiation Program, the on-campus incubator, and got in there, which is fairly competitive. So started getting a lot of positive feedback that this was a real problem that people recognized and there was no good solution on the market. Eventually we went on to build an MVP, a very simple, very basic manual first version of what we have today. And we took that and tested that with our classmates. There were 10 physicians in our executive MBA class. And so we brought it to them and said, what do you think? And then I went around to colleagues, dozens of colleagues. We went to health systems. And the feedback we got from everyone across the board was, this is a huge problem. There is no solution. And wow, I would really love to put this in my office, in my health system. This would be great. So I think once we got all that feedback, that was when it really started to feel like, hey, maybe we can really make a go of this. This is a real business.
So I have to ask you, as a mother, someone who's working full time and also trying to start this business, that is a lot to balance. And I'm sure as people are thinking about the entrepreneurship route, that comes to mind. How can I do all of this and be successful? So what's your secret, Dr. Miller?
Yeah, I don't have a great, this is the secret. I think you kind of just have to do it. You just have to jump. You have to believe in what you're doing. You have to have a supportive spouse if you're married. I think one of the key things is that this is a really hard thing to do. And you have to kind of eventually get comfortable with not being 100% all of the time in all areas. And that's a pretty tough pill to swallow for someone who's an overachiever like me. But knowing that you're going to be 100% some of the time, and a lot of the time you're going to be 98%, and that it's going to have to be okay. I think the other thing is that I try really hard to, when I'm not working, to really put the work down, and the time I have with my family to turn some of that into fun time. So not all about homework and, scheduling and getting things done, but really to have some fun and enjoy the time with my family. And, I think a lot of people worry about having a family and doing this or, balancing home and work. I think in some ways, a lot of my inspiration comes from my kids. My mom worked my whole life. She was a teacher, became an assistant principal. I watched her do it. And I think there's a lot of inspiration I get from looking at my daughters and saying, I want to be a good role model for them.
Mm-hmm. Yeah, I love that everybody needs to find that balance for themselves, and it's so important. And if you're just tuning in, I'd like to invite our audience, if you have questions for Dr. Jennifer Miller or about Navimize and how it works or entrepreneurship, we are going to be getting to the chat in just a few minutes, so feel free to put your questions in there. So let's get back to Navimize, Dr. Miller, because it takes a dramatic turn. Everything was going great, and it seemed like you were getting a lot of positive feedback, and you're starting to get investors, and you thought, wow, this is an actual viable project in the market. And so this was happening in 2019. And tell us kind of what specifically was happening during that time.
Sure. So 2019 was actually a pretty big turning point for us because we finalized a partnership deal with Athena Health, which is one of the largest EMR companies in the country. And through that partnership, we were able to integrate our platform directly with their electronic medical record and then really be an automatic turn right on to any of their customers. And so the way Navimize works is that the platform's proprietary algorithms can actually predict delays in the schedule and then text that information to patients in real time, which is a huge patient satisfaction booster. And then we layered in online review management to capture the increase in patient satisfaction and really saw patient volumes increase for our customers, which was very exciting. So 2019, signed the contract with Athena, started onboarding customers, saw patients benefit from the platform, saw the physicians benefiting from the platform, and saw the waiting rooms start to empty out, Google reviews going up, and things were coming along very nicely.
And then COVID hit. So you created this amazing solution. It was helpful. It was on this great upward trajectory. Customers, medical doctors, healthcare facilities were loving it. And now we have a pandemic and everything changed. So tell us what happened and what you were feeling in those moments.
Yeah, so COVID hit me I felt like it kind of hit from all directions at once. You know, on the personal front, I live in a suburb of New York City, and my town borders New Rochelle, which was the first epicenter in New York. So super early on March 3rd, my daughter was on her way to school and her bus got turned around, and that was it for the school year. So I knew a lot of people personally who were diagnosed in early March. My daughter had friends in her class who were diagnosed with COVID. It kind of hit home very early. On the professional side, I was still practicing a couple of mornings a week at that point, and I took the small practice I had and went to telehealth and was just getting contacted like every day by patients in New York City who were getting diagnosed with COVID, who had classic symptoms. And then my husband, who's also a physician, went to work as a frontline worker, and I was worried about him. So there was all this going on. Now, on top of that, Navimize, what happened with Navimize was that we had these two really big customers who were slated to come on board and start piloting in March. We had a big investor lined up, and then suddenly, when COVID hit, everything was pulled. The large groups one went to telehealth, the other one furloughed everyone and just kept a small skeleton crew. The investors got cold feet and pulled out. So here was a time where my personal and professional life were just completely overturned. You know, it was a devastating time for everyone, but certainly for me, you know, not just personally with what was going on with my friends and family and my practice, but for Navimize, here was this company that I had poured my heart and soul into for the last 3 or 4 years, and I didn't think it was going to survive. Nobody was talking about patient satisfaction at that point. Nobody was interested. So it was extremely distressing and difficult time.
Yeah, that had to be. I can't even imagine that you're on this upward trajectory and then boom, the bottom just falls out. And it was looking like Navimize at that time was going to be another casualty of the pandemic. But then you had an idea. What was this and what was it that turned this all around?
So in March and kind of early April, nobody was focused on patient satisfaction. As I said, everybody was focused on PPE and testing and, you know, what was this virus? And then towards the end of April, after the lockdowns, we started talking about reopening the country. Mm-hmm. And then that's kind of when another aha moment happened. I started thinking, you know, the waiting rooms of the past where everyone crowds, they can't happen anymore. It's no longer about patient satisfaction, but crowding in a waiting room is now a patient safety issue. It's a patient safety challenge. And so I realized that what we built was a platform that in predicting wait times was also predicting exactly when the doctor was going to be ready to see the patient. And so we just changed the messaging just a little bit, went to our customers, worked with them. We had already built in a ton of flexible, customizable messaging into the platform. We changed the messaging around to message new COVID-19 policies and to let patients know exactly when it was their turn to come into the office, and created this virtual waiting room platform. So really just shifted the way we thought about the platform and the product.
Yeah, so it, the pandemic almost created this opportunity for something that we didn't even know we needed, that you had already started. So the product didn't really change much. It was the marketing and perhaps the target audience that shifted, and you took advantage of that, which is brilliant, and something that I think is key to entrepreneurship.
Yeah, so that's exactly right. We actually did not have to change a line of code in our product. We really just changed how we packaged it and what features we focused on. And so we shifted from serving as providing a patient satisfaction tool to providing a patient safety tool. And we really moved in that space, interestingly, from being what a lot of people had considered before a nice to have product to a must-have product. Mm-hmm. And with that, our target audience did shift. So we had spoken to a number of health systems over the last couple of years who were interested but moving slowly, and suddenly they came back to us, and we had inbound leads from health systems who were very interested in the platform, and very interested because they needed to get patients back in the hospital, start doing elective procedures, start bringing patients back in for preventive care. And so suddenly there was this accelerated adoption of our platform, and we very quickly signed 2 contracts with health systems.
So you had this huge acceleration with Navimize, and then you had this dramatic drop when COVID hit. And now you're in a place where Navimize is hiring.
Yeah, exactly. It's the entrepreneurship journey, up and down. So yes, we have actually just hired a lead engineer who came on board this week. We've also extended an offer to a lead salesperson, so hoping that will work out and that he'll come on board hopefully next week. The decisions to make these hires were really in line with our objectives moving forward. So one of our objectives is to expand our offerings. We're seeing a lot of new increased demand for contactless solutions. There's and the salesperson was really to capitalize on this sudden new urgent need of health systems for solutions like ours. So that was the decision making behind the hiring.
So I know, Dr. Mello, that many entrepreneurs and professionals are needing to shift this year. They're needing to pivot, and those that are able to be agile and make those pivots and see the new opportunities the market has created are going to be successful. So as somebody who's done this, what advice do you have for people who may have started down one path but now are struggling to make that pivot?
So I think probably the toughest thing is to shift your mindset and to stop thinking about what your product or platform was and start thinking about what it can be. This really worked for us. So, I had to kind of take a step back and look at Navimize and say, what does this do? Mm-hmm. So I always thought of it as this patient satisfaction tool, but I said, what does it really do? And that's when I thought about, it empties out the physical waiting room. I've used it myself in my own practice and always noticed that not only were people excited and happy that I was saving them wait times, and my staff were happy because they weren't frustrated, the waiting room wasn't swelling, nobody was complaining to them. I was thrilled because my patients were happy, they wrote nice reviews, they recommended me to their friends, my practice was growing. But I always noticed that it emptied the physical waiting room. My waiting room went from crowded to empty. And that was a fundamental feature of the product, and we really just shifted the focus to that. So my advice would be to try, it's always not always possible, but to try really hard to see your product in a new light and really understand what it does and what can it do. I think the other thing is that we called our current customers to see what their needs were in this new environment. And that's always essential, right? Talking to your customers, asking them what they need, really dig in and understand their needs rather than making assumptions. And that helped us a lot as well. So one example of that is that some of our customers had adopted telehealth fairly quickly, and they were finding that their staff were making a lot of manual calls to support their telehealth initiatives, letting patients know this is the link to log on, this is how you turn on your camera, or the patients would log on and drop off because they didn't know the doctor was running behind. So we were able to expand our feature set to help make this process smoother. Provide a clear list of instructions, let them know if the doctor is running behind, and adapted the platform a little bit, and that helped a lot also.
Yeah, the part that I want to key into there is the customers. The customers are always going to tell you what they need and what they want. So I love that you did that and got that feedback, because like you said, now Navimize is a must-have, no longer a nice-to-have. And just thinking about previous doctor's appointments myself, I feel like now I don't want to go to the doctor without this app, because I want to know how long I'm going to wait. So Dr. Miller, the world's continuing to morph and change. And, everything's kind of moving at this accelerated pace. What lies ahead for the future of Navimize?
So I think our product roadmap has shifted a little bit because of the pandemic. Our focus has changed a little bit. For example, one of the key features that we were focusing on pre-pandemic and that we were all set to build out was the ability to fill canceled slots. So what happens in a lot of practices is you'll schedule that appointment with your cardiologist 3 months in advance. Suddenly it's the day before, something comes up, they call you to remind you, or they send you a text and you can't make it. And so there are a lot of cancellations that occur in those last 24 hours. And so we know at Navimize, because we have the scheduling information exactly when those cancellations occur. So we thought, great, we know that, we have the texting capability. We'll expand the offering to text patients who are 2 weeks out on the schedule and give them the opportunity to come in earlier and fill those canceled slots. That was a huge priority before. It's no longer a priority today. While practices want to maximize volume, today it's being very much balanced by the need for patient safety and not overcrowding. So that may come back at some point, but again, off the table for today. Where we are focusing and where we are shifting to is an area that we didn't think we'd go into, which is the mobile check-in and self-scheduling. And there we're thinking, do we build, do we partner? But that's an area that we're looking at very closely. I think our big picture vision has remained pretty consistent. So we always had this idea that once we're integrated and in lots of health systems, we can start looking at data and build out what we call an intelligent scheduling tool, or a machine learning driven solution that can schedule patients based on their needs. So we know we have all this data that other people don't have about how long is the patient spending with the doctor and how long are they waiting. And then if we layer into that their diagnosis codes, who are they, what are their demographics, how old are they, what's their prior behavior, how long did they spend with the doctor the last time they were there. Then we can schedule patients according to their needs. What happens today is you can have a 20-year-old who needs a form filled out and an 85-year-old with Parkinson's disease, and they're both getting scheduled for this 15-minute follow-up, which makes no sense. So to create this intelligent tool that could schedule patients according to their needs would drive efficiencies, increase and maximize volumes without sacrificing patient satisfaction and with doing a much better job of reducing wait times.
Dr. Mahler, I have to say, this is going to be one of those products that we all wondered how we survived without before. Once we have it, we're going to say, how did we get along without this product? And I just want to invite our audience, if you do have a question for Dr. Jennifer Miller or about Navimize or entrepreneurship, we'd love to hear your questions and comments in the chat. But I do have to ask, how did you come up with the name Navimize?
Sure. So yes, it's not a real word. All of the usual sort of normal words out there in healthcare, there's so many companies and there's so many practices and health systems that every time I came up with the name, it was taken. The domain was taken and the name was taken. So what we decided to do was to pull, this was a trick from one of my co-founder, Kavita's Wharton professors actually, was to pull together a list of words and then take roots from the words and put them together and come up with what sounds good. So we came up with this tagline that we were navigating patient care and navigating the patient journey through the office, and also maximizing patient satisfaction and maximizing efficiencies. So we took the Navi from navigate and the Mize from maximize and put them together to form Navimize.
That's great. I love that. It's such a cool name and it totally makes sense. So you mentioned your co-founder, Kavita, and I think you've talked about how important it is to select somebody who can work really closely with you and, also have that kind of push-pull so that you get good objective insight and feedback. What are some of the things that as people are looking for potential co-founders or, in those early stages that they can think about when making those selections to help them be successful?
Yeah, that's a great question. I think your co-founder almost becomes like a life partner for the duration of your working together. There are days where I speak to Kavita more than I speak to my family. I work closely with her all the time, day in and day out. And so I think inevitably, even if you go in as the kind of best of friends, you're not always going to agree about everything. So it's really important to find someone who you can work with and talk things out with and respect their opinion and hear it and really listen to it and have them respect yours and really listen even when they don't agree. And so I think that is probably the most important thing. I think it's also challenging because unlike when you're fighting with a sibling or a spouse and you kind of take a break and walk away and come back and hear each other out, here in business, the challenge is to find a way not just to come to a mutually acceptable solution, but to make sure that solution is a good business decision. And so it's challenging, but I think super important to just be able to work with someone, find someone who you can communicate openly with.
Yeah, so I think we do have some questions that have come into the chat, so I'm just gonna give that a minute. So a question from Steve Davis. What do you want others interested in entrepreneurship to know?
That's a great question. Entrepreneurship is a tough journey. There really are, as you've probably heard throughout this podcast, there really are a lot of ups and downs. And so I think if you go into this, you really need to believe in what you're building and what you're putting out there. I think you have to kind of have a tough skin. You have to know when criticism is constructive and when it's just negative. Mm-hmm. So you have to be a little bit discerning. Sometimes people have their own motives. It's not really always about you. So I've gotten a ton of great feedback, which was great constructive criticism over the course of the last few years. And then I've gotten just very negative criticism that I've had to filter out the two. And I think that's really important to do.
Yeah, that makes total sense. I love that you said people have their own motives. And I think we all have to think about that when we're given advice. We need to be open to it, but we need to understand their motives. Do we have other questions coming in? This one's from Dave Miller. And Dave says, you've covered a lot about the benefits working with a co-founder, but are there any challenges people should be aware of? What do you think, Dr. Miller?
Mm-hmm. Yes. I mean, I have definitely heard, those horror stories where people have had to separate from their co-founders because they couldn't come to a mutual agreement, or even sometimes because something happens in their co-founder's life that's, not under their control. So I think, again, these are challenges. I remember taking a class at Wharton where they talked about like the 4 Ds, and I'm going to have a challenge remembering what they all are. But when you think about working with your co-founder, you have to think about what happens if one of them dies. I mean, terrible things, but you kind of have to think about these things. What happens if they get divorced and they have to move, or something changes in their life situation?
Right.
I said I was going to have a challenge remembering the other 2, but these are the kinds of things that sometimes just happen. So again, I think you just have to be aware that you're working really closely with this other person. It's not like a big company, it's a small company. A lot of what happens with the company is invested in the people who find the company. And so these are some of the things you should really talk about with your co-founder from the get-go. Things like, what happens if something happens to one of us? What happens if one of us has to move? What happens if we decide we're not getting along? And have some of those candid conversations very early on.
Yeah, so it's kind of like a marriage. Exactly like that. So it looks like we have a few more questions. So I will, from Rob Johnson, what's next for Navimize on growing your business?
Sure. So next for Navimize is, I think I mentioned we just hired a new lead engineer. We are hoping to bring on a sales lead next week. So really working on those 2 aspects of growing the company, the technology, expanding the offering, and growing traction for sure.
Another one for Rob Johnson. How effective is queue management for drive-through testing?
Yeah, good question. So this is something we've flirted with doing for a couple of the health systems. especially early on in the pandemic. I think things were a little chaotic then. There were long lines. They've gotten a lot better at that, but yes, that is something that we can do. Anywhere where you have a schedule or can put the patients who sign up to be tested into a schedule, Navimize can manage that and can send out text messages and manage that kind of queue for a health system.
Fantastic. Let's see. Anna Stewart is asking, can Navimize solution be integrated with EMR?
Yes, absolutely. So we are Athena integrated. We are actually right now working on several other EMR integrations with other EMR companies, and we have the process down for integration. We don't need to write back to the EMRs. All the data we take is read-only. It's pulled from the EMR, and the data we need to function is all around scheduling, demographic data, and tracking data. So not a ton of deep ICD data or free written notes, things like that. So it's pretty straightforward integration to just pull that information.
Great. Yep. Carolyn Williams, do you offer real-time messaging with COVID-19 instructions?
Yes, we do, actually, absolutely. That's something that we've done. Again, this was part of going back to our current customers when Navimize hit. And instead of having the messaging reflect just wait times and how far behind the doctor was, we changed the messaging to convey COVID-19 instructions. For some practices, it was, we're moving to a situation where we're going to have you wait in your car, and then we're going to let you know exactly when it's your turn to come inside. For other practices, it was, you're going to wait in this designated waiting area, and we're going to text you when it's your turn to come inside. So yes, that is something that we are doing today with our customers.
All right, it looks like we have one more, and let's see, this one again from Steve Davis. How do you specifically focus on sick patients and minimize the spread of the virus?
Yeah, that's a great question. So, you know, with COVID, I think you sort of have to assume when you're in a healthcare center or as a physician, you have to always be on the lookout and worry that every patient walking through your door could be carrying the virus. And so our objective is to prevent crowding, to maintain social distancing within waiting rooms, and not have situations where patients are on top of each other, essentially. And so our platform is designed so that we really carefully streamline the flow through the doctor's office. So you've got 1 or 2 patients coming in at any given time, and we can actually adjust the platform to streamline the flow based on the size of the office and the physical location. And so we work with the practices to streamline their flow, limit the number of people in any one space at any one time, and that way really limit the spread of virus.
Yeah, this is fantastic, Dr. Muller. Where can either patients or healthcare centers or investors learn more about Navimize and, you know, how they might get involved with this new product that, like I said, I think everybody's going to want?
So they can go to our website, which is navimize.com. It's spelled up there on the screen, Navimize.com. They can email us. They can email me directly at jennifer@navimize.com. They can email us at info@navimize.com. And they can also go to the Radivision website to look up Navimize.
Dr. Muller, this has been amazing. I'm so excited for your product and to see how it impacts all of our lives in a positive way. Thank you for all of this information that you shared today.
My pleasure. Thank you so much for doing the interview, and thank you for having me on the show today.
Yeah, and I want to thank all of our watchers and people who submitted questions today, and all of you who are going to watch this in the future. I think this is a great product and one we all need to learn more about. So thank you for tuning in to this episode of COVIDpreneurs on Radivision, and we'll see you next time.